I appreciate very much that all of you are here. I heard that many people are basically scared when they hear about hypnosis, which is no wonder. Most of you would have heard about it through stage show or movies, the famous Woody Allen, the last one a couple of years ago. So the reputation of the skill or of the art is not the best one, very obviously. However, what we're going to be talking about tonight has absolutely nothing to do with either show or magic or voodoo or medicine for that matter. It is related. It is what we call clinical hypnosis. Although I have to make a first disclaimer that you will hear me repeat a couple of times, if not more tonight. I am not medically trained. I do not diagnose, I do not heal, I do not cure, I do not prescribe any medicine. While I deal with people who are suffering from any sickness or any ailment, all what I do is teach them how to use the power of their brain, a power that each one of us has, basically, but that nobody taught us how to use. Use the power of the brain in order to transform or alter the perception of the pain that they have. So it's very important that at all time we bear in mind that there is absolutely nothing medical or that can approach medical handling in what I do. And any client I would be working with would have to have either a doctor referral, which is very complicated with the situation of our medicine here, but at least that his the physician taking care of him is aware that he is starting to learn techniques to alleviate the pain. Because pain is important, is unpleasant obviously, otherwise we wouldn't be talking about it. But pain is important, we can get back at it later in the evening, but pain is a signal that our body gives us to tell us, hey, watch out, there is something fishy going on, you better pay attention. And by no means should we ignore our pain, by no means should we try to eliminate it and act as if it weren't there. So this being said, this first disclaimer, shortly this evening I'm going to start telling you a little bit about where medical hypnosis is now, giving you a few quotes from the report from the Mayo Clinic in the United States. After that, I will demonstrate to you what we call hypnosis analgesia. Liliane Levy, that I hypnotized yesterday in order to avoid wasting much time here, will be entering into self-hypnosis as I showed her yesterday. So that is basically the pattern that I teach my clients. And in this state of hypnosis that we are going to be describing and defining a little bit more this evening, one of the characteristics is that you can suggest and the person hypnotized believe, and her body, which is much more important, the body acts as if it is numb or you have removed its sensibility. That is the analgesia. And so that's what we'll be doing with Liliane. And I have here my implements of torture. We'll see if she screams. So that will be the second part of my talk. Thereafter, obviously, there will be a lot of questions that you would be eager to ask. Before going there, I will explain to you for what conditions and how does this analgesia that we have produced on Liliane can be used for everyone who is suffering of any type of chronic pain, repetitive chronic pain. And that will be, in fact, all what I would have to tell you, answering your questions. And at the end of the evening, if time allows and if people are interested, I can make a small demonstration of 10-15 minutes for whoever wants in group, showing you not what hypnosis exactly is, but what a state very similar to it of very pleasant relaxation can look like. But this is really up to whoever is here and whatever time would have elapsed by then. Literature started talking about hypnosis as we know it, or similar to what we know it here, in the 18th century, starting with a gentleman by the name of Franz Anton Mesmer, Austrian, but who was living in Paris. And at the same period, approximately, there was a British guy by the name of Baird, and another very famous one who was very important is a Scottish surgeon by the name of Esdale, who was in India and had successfully operated surgery. By then there was absolutely no anesthetic at all. Had managed to perform surgery pretty much painless and with pretty good results of rapid healing with the means that they had back then at that time. So there was, yes, some part of show in it, because part of what induced hypnosis is show, but it was from the very beginning for healing and for curing purposes. Most of them, except for these two gentlemen who were successful, there were a lot of charlatans, as usual, who are riding the wave. Later on, the next century, it was mostly used in psychiatry, Freud, psychoanalysis. They weren't very successful. They didn't know really how to manipulate the state. They had maybe also wrong expectations. So that makes that in Europe for quite a while, hypnosis was neglected. And that is when the show trade started taking possession of it. We do see a resurgence in North America, in the United States, starting in the 50s, of research for applications, for useful applications of hypnosis in everyday life. Again, always in counseling, in therapeutic, in psychotherapeutic field. That is where in the 50s and 60s we have the school of Palo Alto in California, and a few very famous names who really started achieving success in what they call in their jargon quick therapy, achieving results for removing phobias and psychosis much faster than the usual counseling and therapy. From there evolved the NLP, the neuro-linguistic programming, who really studied the model of Milton Erickson, the founder of the School of Palo Alto, and derived techniques that are simple to use, simple to understand, in order to induce that state and to, once that state induced, make something out of it, bring the client to a conclusion, to a better communication with himself. It's in 1958, I think, that the American Medical Association started accepting hypnosis as part of the therapeutic tools that her members could use. And recently, with the progress of functional MRI and all imaging technologies, researchers, neurologists have managed to not really understand exactly how it functions, but to pinpoint the areas of the brain and the areas of the spine, the areas, in fact, of our nervous system that are involved in the hypnosis phenomena. And we have no doubt that in the next few years they will be achieving even more insight in understanding what is really happening. Because up until now, hypnosis is, as the report of the Mayo Clinic says, is evidence-based. We see that it functions, we know that it functions, we don't necessarily know why it functions to achieve the results that we want, but we have a pretty good grasp of what to do in order to get from A to B. I have here a handout for you that you could take with a few articles from the Mayo Clinic, as well as their links on the web for whoever want to be looking at them in their entirety. I'm going to quote a few lines from it here. As an article says, hypnotic gaining a legitimate role in healthcare treatments, and it's dated April 2007. They start, hypnotism has expanded its role from magic shows to healthcare. As a potential component of care, hypnotism is gaining legitimacy for a number of conditions, particularly for managing pain, according to the April issue of the Mayo Clinic Health Letter. Exactly how hypnosis works is not clear, but it is generally considered an altered state of consciousness, or trance, in which a person has focused attention and a heightened ability to respond to helpful suggestions. That is in fact what it is, the capability of responding to suggestions. When I tell Liliane or whoever your arm is numb, you have absolutely no unpleasant feeling. That suggestion is accepted, and from that time on, her arm is indeed totally numb. Okay, here they have a list of hypnosis has been shown to help relieve severe acute pain associated with childbirth, burns, surgical procedures, dental pain. It can especially be helpful for people who can't take pain medications, obviously, or for whom medications aren't effective. Hypnosis can also be a component of therapy for other conditions, including reducing anxiety before surgery, symptoms of skin inflammation, dermatitis, asthma symptoms, as well as to aid smoking cessation. Hypnosis is generally considered safe, but it only works in patients who are compliant. And that is really the key to it. The fear from hypnosis or from a hypnotist is that he's going to take control over me, he's going to make me cluck like a chicken, or he's going to make me do all sorts of things. Hypnosis functions only with compliance, with a person agreeing to be hypnotized and agreeing to do whatever she's asked to do. So you would ask, why would on earth people do those ridiculous things that we see on stage? Well, there are people who like it. Don't forget that they all volunteer. Nobody has ever forced them, first, to pay money to come to that show. Second, to volunteer to go on stage. So there are very good reasons to believe that, yes, they feel like doing it. And it's not that they are surrendering control. It is absolutely, there is a part of volition, of personal volition, and of compliance. Anything interesting in that article? Yeah, in other words, hypnosis can't make people act against their own wills. Another study published also by the Hypnosis Clinic, I'm going to read you only part of the abstract and the conclusion. It is an interesting one. Whoever want to know a little bit more about it would be advised to go to that link and read it. They really detail all kinds of studies that they have made and the results statistically proving for what it's good. So they say again, hypnosis became popular as a treatment for medical conditions in the late 1700s, when effective pharmaceutical and surgical treatment options were limited. To determine whether hypnosis has a role in contemporary medicine, relevant trials and a few case reports are reviewed. Despite substantial variation in techniques among the numerous reports, patients treated with hypnosis experienced substantial benefits for many different medical conditions. An expanded role for hypnosis and a larger study of technique appear to be indicated. They proceed further, saying, no attempt is made herein to explain the mechanism of hypnosis for causing the intended change. If positive suggestions for change are accepted by the mind, and physiological changes that follow defy explanation by contemporary medicine, although complex explanations have been proposed. And the study goes further, enumerating fields of application and detailing research in anesthesia for surgery, dermatology, gastroenterology, hypertension, healing from surgery or injury, hematology, neurology, obesity, obstetrics, oncology, otorhinolaryngology, rheumatology, surgery, urology, etc. Apparently, it does, properly used, properly applied, it does help almost everywhere. For in fact, a very simple reason, it is what medicine is starting to understand a little bit more today, very simply the mind-body connection. There is much more going on there than we ever suspected going, and there is, it seems, ways for our mind to influence positively. We know how it does it negatively, to influence positively our health and our well-being. And the paper concludes, the acceptance of hypnosis as a mode of treatment in medicine is increasing as a result of careful, methodical, empirical work of many research pioneers. Many important trials reviewed here have helped to establish the role of hypnosis in contemporary medicine. By the way, this was 2005. These trials have established the utility and efficacy of hypnosis for several medical conditions, either alone or as part of the treatment regimen. And in fact, hypnosis should also be seen as part of a regimen in what they call today complementary alternative medicine. And according to a recent study, healthcare providers changed their attitude significantly and positively when presented with information about the use of hypnosis in medicine. Through greater awareness and acceptance of hypnosis, additional training and research can be inspired in pursuit of improved techniques. And one last short thing, because they detail the treatment options that the Mayo Clinic itself offers where it is using hypnosis. And I picked up on the internet Mayo Clinic because it's the most famous one. In fact, research abounds all over the place. Especially here in Montreal, there is Professor Renville at Université de Montréal in neurobiology, who has done a lot of work in the field of pain management and studying under functional MRI the phenomena that are happening. So this is where they say that Mayo's approach to hypnosis is evidence-based. Treatment recommendations are based on continuous research by Mayo physicians and scientists to identify the most effective therapies. During hypnosis, that's also interesting to know, the way they formulate it, patients can tap into and use their inner resources, make personal changes, and learn how to manage their lives more effectively. You would believe that it's really a cure-all magic powder. Hypnosis may be helpful when used for behavioral change, insomnia, substance abuse, phobia, sleepwalking, pain management, again, chronic and procedural pain, irritable bowel syndrome, childbirth, fibromyalgia, hypertension, weight management. Here we are again. Hypnosis may also help improve immune function, increase relaxation, decrease stress, ease anxiety. American Medical Association has recognized hypnosis as a valid medical treatment for certain conditions since 1958. And as I say, you will find references all over the place about the use spreading more and more by physicians who are themselves aware, and unfortunately it's only a minority. The situation here in Montreal is, I think, certainly not I think, is much worse in this respect than it is in the States. Much less people have heard about it. There are, as far as I know, maybe half a dozen or a dozen hypnotists in Montreal, Quebec, working in both languages, and most of them, none of them that I know of, except for a gynecologist, a lady, none of them is really involved in pain management. They are more on the personal development aspect of the story, including regressions to past lives and these sort of things. So there is absolutely a need to inform people who may be suffering, whereas a solution or a relief does exist. Inform the physicians and the medical body about the existence, about the validity, the efficacy of the story, and no, it's not only charlatans and abusers trying to take advantage of people's suffering. And that is where I found that there is a role for me to play in organizing evening like this, in spreading the word a little bit more, that whoever is suffering from any pain cannot find relief with the medications that are offered by the industry today, either that those medications are not helpful or side effects are too powerful to compensate for the well-being, that there is a solution. I'm going to show you how it functions. It's not a miracle solution. It doesn't necessarily function with everyone. You have to own it. You have to own it also seriously, because we find very often with people suffering from chronic pain that they get somehow, we call chronic pain a pain that is recurring after 6 months, which has outlived its usefulness. A signal that something is fishy after a month, 2, 3 normally is understood, and action has been taken, and the medical science today is supposed to be able to deal with. If after 3, 4, 5 months nothing has happened, that's where we call it chronic pain. That is where it is installed and where normally people navigate from one medication to another until they get used to it, loses its efficiency, and go to the next one. And I wanted to touch on the subject that is a hindrance very often in the treatment. It's something we call, or it's called in the jargon, secondary gains. It appears that people suffering from chronic pain, either, besides getting used to it somehow, may end up finding, subconsciously or not being totally aware of it, some advantages in having that pain. Be it that they are under work arrest and they would lose their disability pension, be it that their children would stop calling them, they would have less attention. People dealing with pain management find very often that a solution, and I have experienced it with nobody else but my late brother, solution functions for a week. He knows it, I taught it to him, we checked it, he can go into self-hypnosis, he can numb that place, and then I leave, he was living in Paris back then, and he stops doing his exercise. He has the recording, all it takes him is after he's shaving or while he's shaving, half an hour, listen to your recording, and you know, you've seen it, you've experienced it, you're pain-free and you're a happy camper. When he doesn't do it, nobody can force him to do it. So the point I wanted to make is that hypnosis is not a magic wand. It does offer a solution. It's not a push-button solution, the same for everyone. Thanks God, we have our human psyche. We are very different from each other. But yes, there is a way, and for whoever wants it, it is very, very seldom that a good practitioner does not find the proper way, the proper window in which to enter the subconscious mind and have him use that power to improve his quality of life. So now I think, Liliane, I'm going to need you, if you want to please come. Pain doesn't exist as an object. You want to buy kilo pain, you want to move pain, it doesn't have a shape. It doesn't exist. It's not an object, it's just between our ears, it's a perception. It's very true. I mean, when you're suffering, you're suffering. I'm not putting that into question at all, except that pain doesn't exist as an object, and it's a creation of our mind through our brain, caused by an impulse, but we can act on it. And that definition, that is very pedant and doesn't explain much to me, says, pain is an unpleasant sensory and emotional experience associated with an actual or potential tissue damage or describes in terms of such damage. So there has to be a damage or a potential damage so that our body sends the signal, hey guys, watch out, there is something happening. You put your hand on the fire, if you don't remove it, it's going to be really bad, so better. You just twisted your ankle, if you keep on walking on it, it's going to be hard to solve, so better stop. And we define analgesia, that comes from the Greek, an, removes, and algesis is the sense of pain, so analgesia is without that sense of pain. Analgesia is defined also as the fact, or described as being unable to feel pain while still conscious. And in fact, what's happening is that the body feels it, except that the brain does not translate it into pain. The signal has been somehow hijacked, interrupted, blocked, transformed, or whatever, and thus the pain does not, that's what analgesia is. So in order to provoke analgesia with Liliane yesterday on that part of her arm here, the first procedure is to what we call hypnotize her, which is helping her, guiding her reach that state of consciousness, which has nothing to do with sleep. Most hypnosis take place with closed eyes, but it's not a condition. It just facilitates to get into your own world. and through a series of a few exercises of imagination, because one of the definitions of imagination is a state of enhanced imagination and very focused. So through suggestions and putting on the imagination, we bring the body and the mind progressively into a state where the brain waves are calculated or measured at around 4 to 6 megahertz. That's for the scientific, but we really don't care. I don't go measuring them. Except that we know that at that state, each one has a very enhanced suggestibility. That is, by the way, a very natural state. Each one of us go through that at least twice a day, morning and evening, before sleeping, and before waking up and before sleeping. But very probably a dozen times a day, you're reading a book, watching a movie where you get really entranced in the movie. You're driving home and suddenly you are somewhere else, or you missed the exit because you are totally somewhere else in your thoughts. That is exactly the same phenomena. And that is the same state of mind that we as hypnotists try to induce into the person, and much more important, progressively teach the person to reach that state on her own. Boring is also hypnotic. So that is what we did yesterday. Then I had the time to install what we call a trigger, so that Liliane now has a trigger to put herself into hypnosis. And in that stage of consciousness that is different from the one you are here, and different from the one when we are sleeping, I have suggested to her that we have put a switch here, just a switch, electrical switch, flip on, flip off. Oui. Okay. Is it okay like that? So we suggested that we have a switch here, just like an electrical switch that interrupts the signal moving to the brains and back. And to be on the safe side, because we always want to be safe, we also installed the hypnotic analgesic that I rubbed on her hand here, that made her totally numb. And once that was the case, and once she accepted it, obviously, because if she hadn't, I think she would have kicked me. We were capable, or she was capable of eyes open, looking at herself, being tortured with that. And I didn't allow any to
Ils ont pitié pour moi tous.
Bien sûr, ça se voit, je suis le grand ogre méchant. So that is what I'm going to show you now, or Liliane rather is going to be showing you. And from that we will develop on how to, because not everyone is suffering here, is how to move that numbness or similar state that we would have induced to the proper part of the body that is giving us problem.
Can I ask something?
Sure.
Where does she feel pain? In her
Right
arm?
now, Liliane feels pain nowhere.
I see.
By the way, is anyone suffering from any headache, any pain, anything tonight here?
I suffer from here because I fell on my body.
Okay. No. Okay. We're going to get at it a little bit later, at least it's important. I imagine, are you suffering from chronic pain or
No, I fell.
you fell? And you, madam?
Chronic, yeah.
Okay, so you are certainly used to your own scale, 1 to 10. How's the pain? How do you measure it?
Well, I measure it, well, I have rheumatoid arthritis for about 45 years.
Okay.
And I have like a lot of pain all over.
Right now, how are you feeling?
Well, I am numb. Right
You're
now.
numb.
Yeah, because I do.
You take medicine, you take, no?
I take medicine, but I do what you are practicing
Absolutely.
on my own.
A lot of people
In a
learn
way,
it by
I
themselves.
don't know how I do it, if it's your method or something else.
They are all valid as long as they're giving the
I
results.
can't numb my body.
Yeah. If there is anyone who is suffering pain right now, on a level 1 to 10, around 4 or 5, we can demonstrate without doing hypnosis, because we do have a lot of tricks in our toolbox, what we call waking hypnosis, without induction, on the spot in 2-3 minutes, teach tricks to reduce that pain by 20-30%. Not remove it, obviously, but reduce it and make it render the people functional. Ta question, j'y ai répondu dans...
Oui.
Non, si
je
j'avais
demandais
mal.
si elle-
Ah,
si elle avait
non,
mal,
donc
qu'elle-
elle n'a mal nulle part.
Tu
And
peux
that-
leur expliquer hier comment quand j'étais endormie.
Tu vas leur expliquer tout à l'heure. Once you've demonstrated it, I'm sure there will be tons of questions, more addressed to you than to me anyway, because... okay, are you ready, Vivian? Tu veux te tourner ou comment tu...
Il faut qu'elle me
Peut-être
regarde.
qu'elle ne sera pas concentrée si on la regarde.
Voilà, si tu veux, tu peux te tourner pour commencer l'hypnose et puis ensuite, comme je vais te montrer, tu seras plus à l'aise en ayant pas tout le monde derrière. Tu vas ignorer, tu veux que je reste en face de toi. I'm going to be for a while in front of her so that she can relax, close her eyes and get into that state. It is somehow annoying maybe to do it in front of the whole public, but si,
Okay, but don't laugh at me, huh?
I'm gonna
Sure,
make sure.
because I can hear. My eyes will be closed, but I can hear
and in fact she'll
everything.
describe to you that the state of
I can hear
sometimes that
everything.
she's aware of everything except that more likely than not she's not going to be bothering or she's not going to be bothered very
Yeah,
much
I
by
will be
anything
like
that's happening.
weak, like, you know, like in a spa. You will relax, like, it's
Okay.
Wow,
amazing.
that sounds good.
Yeah.
So
Like
where are you
taking
going to
few,
where are you going to find
That's
it? Tu veux que je reste en face de toi ou ça? Oui, oui, je vais parler. Now, I'm going to be maybe mumbling a little bit for the first few minutes and in French, and I put her in the state that I want, and then I'll be back with you, facing you and talking to you. Bon, donc commençons par respirer. Trouve ton poids. Et commençons à respirer tranquillement. Prends ton
Sure, I
temps.
mean, be nice, huh?
It would be nice if we could give her, at the beginning, at least a few minutes of quiet and peace. Thereafter, it doesn't really matter. She would be oblivious to it and she wouldn't care. So we start with finding a point to fixate with your eyes. And beaucoup plus important, ta respiration. Comme on l'a indiqué, des inspirations profondes. Monter jusqu'à 3. Et puis expirer. Et continuer à répéter toujours ces respirations tout en fixant bien le point en attendant que tes paupières qui s'alourdissent de plus en plus. Très bien, tu les laisses aller. Et Sauf que ça ne te fera absolument, absolument rien de désagréable. La chair qui est complètement fait. Tu peux la remettre parce que c'est probablement plus confortable pour toi. Mais l'essentiel, c'est que ici, quoi que je fasse, quelle que soit la pression que j'exerce, rien. Tu peux ouvrir les yeux et me regarder faire si tu le veux, ou tu peux rester comme tu es en ce moment. Alors que tout à l'heure, très certainement, nous allons voir le photographe de ta sensibilisée et l'effet que ça donne. C'est absolument parfait. Tu peux continuer maintenant à rester profiter de cet état pendant que je vais expliquer aux gens ici en anglais ce qui s'est passé. Et toi, relaxe-toi, profite-en, c'est tellement agréable. So, what I have done, I was a little bit more quiet, and with Liliane we're more familiar in French, that's why I switched languages. I have reintroduced the hypnotic state that she was in yesterday. It may have taken me, I think, 5 or 6 minutes. Yesterday it took 25 to 30 minutes. This is a teaching process. Normally, after a week or two, after a couple of times anyway, the person has learned to enter into that state in a fraction of a second, as a matter of fact, or as fast as it wants. We are not in a championship, it's not a race. But the beauty of it is that, yes, should you need, for whatever reasons, to enter into self-hypnosis at any time, you can do it immediately. For a minute, for 5 minutes, for 15 minutes, it's something that we teach you how to come out with at the time that you have decided. So it took me a little bit shorter than yesterday, longer than I would have wanted. I deepened that state to make sure that we are where we want to be by counting her downwards from 10 to 1. And once she was in that state, and I could check it on her eyes, on her movement, on a few things, that she was in that state, then I could give her the suggestion that you have the switch, you're going to put it in an off position where you feel nothing more, and to be on the safe side, I'm putting another extra layer of hypnotic sedative cream on your hand, so that now, no matter what I do here, you are not going to feel anything. The signal is just not going to reach your brain. So you've seen what I have done. I didn't want to put a blue mark on it, but just as a comparison.
Hi.
Excuse me. I normally have much worse instruments that look really scary because I know that it doesn't do anything on a woman's arm, especially now in summer. I don't want to leave marks, but it is really totally numb. They do surgery in this state of without anesthesia. Obviously, they do surgery, but without anesthesia, in a state similar to this one. It is, besides the fact that we can induce analgesia there, it is a very pleasant state, very relaxing for the person. So Liliane now is having a really good time. She is aware of everything that's happening here. She hears me. If I talk, we can have a conversation. Very likely, her talk is going to be slow and hard, but eventually she can be eyes open totally here. But right now I'm going to leave her in that state because it's very pleasant. She is recuperating, she is relaxed. She'll tell you more about it whenever she is done. I'm going to take advantage of where she is now to tell you a few more words about how to use that state should you be suffering from chronic pain. And Ellie finds it up, so she's quiet, hein? Elle te fout la paix.
Tu m'apprends comment l'hypnotiser. Hein?
Non, je suis un très bon ami, mais je ne ferai pas ça.
Comment moi l'hypnotiser.
Ellie, you can have your way with her now.
How's she going to wake up?
Well, either I wake her up, and normally I do. If she has learned self-hypnosis, she would have decided before that I'm going into hypnosis for 10 minutes or 15 minutes or 3 minutes. And we do have an inner clock that functions pretty well. And normally we do teach people also to synchronize that clock with the real clock. But within half a minute, if she says 5 minutes, she's going to be up at 4.5 or 5.5, whoever. And that is the eternal question, can I be stuck in hypnosis? Nobody has ever been stuck into hypnosis. The next thing is going to happen is going to wake up as you would have waken up if you went to bed normally.
But she's not in a position where.
It's not a comfortable one.
Yeah.
Absolutely. That's why when we work in hypnosis, we always keep them in an uncomfortable position because we don't want to sleep. Otherwise, sleeping is so tempting, and then we lose the contact. So it's wasting time, wasting money. Oui, André.
So when she goes to sleep, do you tell her that if she has pain, let's say back pain, you will not feel the back pain anymore? If not,
Okay.
she'll wake up, she'll still have pain.
Yeah.
So how about,
That is where we're going to get a little bit into the details. So we teach people who are suffering from chronic pain self-hypnosis. So now you know that you can get into that state.
that's right.
And now we talk together, where is that pain? When does it occur? What kind of intensity, and how you want to modulate it. Because again, we will never ever do that where you feel nothing. It's forbidden, it's unethical, it's whatever you want, it's unsafe. So we're going to be discussing, okay, what is the deal? Is 20% reduction, is 40% reduction, morning, evening, what is giving you that freedom of movement counterproductive to whatever is happening? I don't know, why do you have that pain? And from there on, we modulate. So it is normally a treatment, if you want to call it, or a coaching that takes, on average, 3 to 4 sessions. First one, you learn hypnosis, self-hypnosis, and the next 2 or 3, we work together to find what is the ideal metaphor. Okay, so here we use what we call metaphors, 2 comparisons. The subconscious mind, when you're in that state, understands literal things. So whether we know that electricity currents goes up and down, we know how our nervous system functions, so it's an easy one to catch, easy one for the person to. The hypnotic analgesia cream as well. There are a gazillion other comparisons, other metaphors that we are going to be eventually using with each client. And then the final thing is teaching the client whenever you need it. This can last, the effect of an amnesic analgesia, if I don't remove it, now before waking her up I'm going to remove it, may last an hour or a day or a week, no idea, no control about it. But it's totally immaterial because we have taught the person to enter into self-hypnosis again and to reinstall that trigger on off again or whatever that trigger is. So if it lasts half an hour, you're going to go into self-hypnosis every half hour to reactivate it. And if it lasts a week, you're going to do it only once a week. We normally recommend making the self-hypnosis part of the story part of your daily ritual, because besides reactivating your pain management trigger, it is a very, very powerful regenerating state. And I think everyone who has the chance to twice a day go 5 minutes will certainly have benefit, just well-being benefit out of it.
What did you tell her to
Oh.
sleep?
What did
Who
I
would
tell her
like
to sleep?
To hear you, to hear what you told her when she went to sleep.
Okay, the induction you
That's
mean.
right.
It's a 15 to 20 minutes procedure where we go progressively, and there is again absolutely no magic in it. Like you can learn it within an hour, memorize it, and you will be able to hypnotize the person next to you. That is not the trick. The trick is once the person is hypnotized, what to do, how to say, what to say in order to achieve that. So the procedure is we go through, there are gazillions of them. You go on stage, you'll see them by having the fingers coming close to each other or hanged claps. Or the one that I use is called the Ellman induction. I didn't invent it. Is a very easy and systematic one because it allows us to interact and to see where we're going. It starts by having eye fixation. You find a point that you fixate. Eye fixation physiologically brings with it the fact that your eyelids are going to get tired, that your eyes may start tearing, and that your eyes are going to close. you close your eyes. The second one, the second exercise or on the second field we work on is respiration. Deep inhale, deep exhale. There is a pattern of respiration that is very propitious to continuing through that state. Third step is we relax the muscle of the eyelids. This is to show the person that you have the power by your mind, by your imagination, to induce actions that normally you wouldn't induce. So we suggest that your eyelids are so tired, are so relaxed, that they are pretty stuck, that you almost can't open them. Of course, you know that you can open them, but right now, because of your imagination, you have relaxed them so much that they look like they are stuck. Try to open them. If she does open them, it means she hasn't been following my instructions. We have to start from scratch. If she doesn't, we are progressing. She is progressing towards the proof that she can relax her mind, her muscles. We go through the rest of the body relaxing, and then the final one is a relaxation of the brain, of the mind, by what we call negative hallucination. There is a variety of things. There is what we call instant hypnosis with shock hypnosis, just by shaking the hand of the person who wants it again. It's not, that's what you see mostly in stage show because it's very impressive. Yes, Mr. Shane.
Can you wake her up immediately if you want?
Oh yes, absolutely. You want me to?
Yeah,
And then
yeah.
we'll bring her back to sleep again. So Lilian, now Mr. Shaheen want to see how you are. I'm going to count to 3, and the count of 3, you will get back to the here and now, refreshed, full of energy, eyes open, in excellent mood. 1, 2, 3, eyes open, Lilian, eyes open, back here. How are you feeling? Okay. Sleep, let your eyes go down, back again, and relax. We're going to leave you in peace again. Mr. Shaheen, relax. So yeah, now she's going to enjoy again the rest of the
Can I ask you,
evening.
please?
Sure.
In terms of pain control, during hypnosis, what is the residual value of that hypnotic state after the wake up? Anybody know?
What if you residual?
Let's say-
You're back fresh and as you are, and you're functional.
No, I know that, but I'm saying, let's say she had a pain level of 10 before hypnosis. You hypnotized her, she went down to 0. As she wakes up, is she going to be back up to 10?
No. First, we're going to bring it 1.5 to 2. Right? Because as I say, that pain, that signal has to be there. I have no right to, and you should never accept that anyone removes that. So we're going to bring it to 1.5. And that is that's what I said, it can last for an hour or a week. I have very little knowledge beforehand. Once I know the person, we can evaluate, and the odds are that we're going to be right. So it may last a day, it may last a week, it may last a couple of hours. However, we are not trying to put the client into dependency state. We showed him, once it's gone, that's how you get it back. Am I answering your question?
Well, in other words, it varies. Some people it's good enough for a
Absolutely.
week, others for a
Absolutely,
day,
yeah.
and they may need to restart this.
Absolutely. When we go into much tougher pain in palliative care and burn, second-degree burn, we have other techniques that is the guy I named Esdale. That's the surgeon who produced it back in the 19th century. We have a state that is called the Esdale state that some other hypnotists call coma state because it's looks like coma. That lasts for a few days. That is where we want the client, especially burned patients, not to move at all. So we can put them in that state. Other than that, for normal chronic pain, it's really the self-hypnosis and do wash and rinse just like shampoo.
Est-ce qu'en même temps que vous hypnotisez une personne, est-ce qu'une autre personne peut être hypnotisée en même temps qu'elle?
On fait des inductions de groupe, oui.
Oui, on aimerait être tous hypnotisés.
That is what I suggested at the end of
Parce
the...
qu'elle a l'air très heureuse. Oui. Elle s'en fout de nous. Elle dort, elle s'en fout. Must be very comfortable.
Okay, just a sec,
C'est agréable.
Liliane. again.
Alors, viens faire ça.
I'm gonna wake you up again so that you are finding a seat that's comfortable. It is worried about you. So just get ready. I am gonna count as usual to 3, but at 2 you will start maybe to stretch if you want to really feel good. And at 3 you are full of energy, feeling so good, feeling so fantastic, and keep on that feeling with you for the next few days. And 2, on s'étire un peu, on se réveille et 3.